First of all, I want to sincerely thank the committee for giving me the Renner Award. It really just, it touches my heart. It means so much to me. When I sent this off to my wife Penny and my 4 kids, and they said, "Dad, congratulations," I felt like I had gotten sort of the National Honor Award in high school. It was just absolutely wonderful, and it just touches my heart. And I've been asked to say a few words about the work that I've done in Wisconsin, in addition to my being a family doc over the last 3 decades, and really how I propagated the Wisconsin idea in my practice and in the other work that I've been doing. And the Wisconsin idea is really taking the education, the information, the knowledge, the research from the University of Wisconsin and extending it to the state, extending it to the nation, and extending it to the world. So a little bit about myself. My first year I went to the University of Illinois in Urbana-Champaign. I wasn't happy for a bunch of reasons. I called up a friend of mine on the phone who was at Wisconsin. He said, "You've got to come up here. It's an exciting campus. People are talking about things." Remember, this is the 60s. And so I came up here, I walked into the Union, sat down on the terrace, had a beer, and realized I was home. That even though I was born in Chicago and bred in Chicago, that wasn't my home at all. And for the most part, I haven't left since. I had to go back to the University of Illinois in Chicago to go to medical school. Finished up my training in Halifax, Nova Scotia, because my wife and I loved it and thought we would live there, but then decided to come back to Wisconsin. And so I came to Wisconsin initially working at Meriter Hospital in the emergency room, trying to find a family practice that I really liked, and then settled in Oregon with Doctors Kellogg and Dukershine, who started that practice in the 50s. And I'm sitting in my office, so picture this, one day I'm sitting there telling my 10th patient to quit smoking, I think. And I thought, there must be a better way to do this. There must be a more efficient way to do something like this. What about through the media? And so I thought, maybe doing something on the radio. I was a listener, Wisconsin Public Radio, listening to Tom Clark's morning show. So I called them up and I said, "Why don't we do something on smoking?" And they said, "No, why don't we do something on flu? Everyone here is sick. And why don't you do something live?" And I said, "I can't do anything live." And they said, "Why not?" So eventually I became a regular on his show, once every week or two, doing a small live commentary for 2 to 3 minutes. And then I told them, "Why don't we try a 1-hour show?" And that morphed into the 1-hour show that we do today. So the show, Zorba Paster on Your Health, we have, it has legs, as we say in the business. It's been going on for more than 2 decades. Right now we presently have between 100,000 and 150,000 listeners every week. We have about 10 or 20,000 who download our podcast. We've been in a variety of markets. At one point we were in New York, Miami, we were in San Francisco, and now we're in still a good number of markets. I tweet. I'm on Facebook. When I post something on Facebook, we get about 2,000 hits when I post a medical story on Facebook. And the idea that I have behind this, behind the radio work that I do and the TV work that I also do once or twice a week on Channel 3, on News 3 in Madison, is patient education. As you know, patient literacy, health literacy, is a huge issue. It's a great, big, giant issue. People who have health literacy are more likely to make the right choices, more likely to be healthy, more likely to get the health care that they need when they actually need it. And there's lots of data that shows that. And my thought is that health literacy begins with media of where people are looking. So when people leave my office right now, I give them an after-visit summary. Most people take that sheet of paper, put it in their pocket, and never, ever, ever look at it again. They never look at it again. On the other hand, if they get a snippet on the news, if they happen to be looking at the Packers or the Badgers, and before that there's a snippet of healthcare on News 3, or if they happen to turn on Wisconsin Public Radio or somewhere else, they may actually get something incorporated into their life and make a change. And that's the Wisconsin idea. Taking the education, the knowledge, the expertise at the university, spreading it to the state, the the country, and the world. And that's what I think I do, and I hope I do, with my public radio show. I also did a show on Wisconsin Public Television based on my book, The Longevity Code, Your Personal Prescription for a Longer, Sweeter Life. That book saw some good, it had a very good publication. It was about 45 to 50,000 copies. The PBS show was very well received, and that morphed into lectures on longevity, which I give around the state and around the country. In the state of Wisconsin, I've given 5 lectures this year on longevity, and I've got about another 4 or 5 that are also scheduled at a whole variety of different things. Again, taking health literacy and the concept of what I would call infotainment, information packaged in an entertaining form. Because if it's dull and boring and list-like, it's not going to be looked at. Nobody looks at it because it's a list. It's not very good. What you need is good information. And that's my concept behind sort of the Wisconsin idea. So I do a radio. I do TV once a week or twice a week on News 3 in Madison. I have a book. My most recent sojourn has been my column. I'm in the Wisconsin State Journal every Sunday. We're in 4 other newspapers. And the column has also had really good success. If you look at the column, if you go to madison.com, you can pick it up if you don't get the Sunday paper. And the idea behind the column is to make things interesting, controversial, and not boring. Dr. Gott used to be the column that the State Journal carried, and Dr. Gott's columns were so boring that I would fall asleep before I finished the column. It was like, how do you treat bunions? Well, who really cares about bunions? What we really care about is, why aren't you immunizing your children? So when I write columns and they're controversial, they're wonderful. I get hate mail, tremendous amount of hate mail. When I am pro-immunization and say it doesn't cause autism, I get a slurry of hate mail. When I say e-cigarettes, we don't know if they're safe, but we know they're addictive, and we also know that anything other than pure air is maybe not good for you, and we won't know for 20 years. I get hate mail, and that means people are actually listening. And to me, it's that listening and that concept that really spreads health education, which leads to better health in the state, in the country, and maybe in the world. So my latest sojourn has to do with Tibetan health, and if you'll allow me to go back, let me go back to the 60s again. So here it is, University of Wisconsin in the 60s, pre-med. I'm a science geek and a computer science geek. I like chemistry, physics, not as much, but chemistry is okay. And a friend of mine, Polly, said, you've got to go and listen to this young Tibetan monk in my comparative religions class. And that's the idea. In Wisconsin, there was, if you will, an intermix of ideas, unlike Illinois, where you were really almost in a silo. With separate ideas. So I went and met Geshe Sopa. Now, Geshe is an earned degree among Tibetan scholars, and he had escaped with His Holiness the Dalai Lama when the Dalai Lama escaped from Tibet in 1959. When he went over the border to India, Geshe Sopa was with him. And Geshe Sopa came to the University of Wisconsin, the first academic institution in the country to recognize Tibetan culture, Tibetan language should be taught, and Tibetan Buddhist thought should be taught. UW actually did that. It was wonderful. So I met Geshe Sopa, became connected with him, became very interested in Tibetan culture. And the reason why the Dalai Lama has visited Madison so much was because of Geshe Sopa. He was one of the Dalai Lama's teachers. My wife and I were involved with bringing the Dalai Lama over to Madison. And then in 1981, we moved out of our house, and the Dalai Lama stayed in our house for 2 weeks. And this was before he became well known. And we came back to the house to make sure that things were running, and the house has never been the same since. But moving on, so I go with Dr. Sen, the Dalai Lama's doctor. We go with the Dalai Lama up to Mayo Clinic for his annual wellness physical every year. We've been doing that for 7 years. And let me tell you, it's a trip being with the Dalai Lama and advocating for him. Extremely bright, very interested in his health at Mayo Clinic, one of the bastion ivory towers of medical care. So when I'm talking to Dr. Sen, this is a few years ago, about Delek Hospital, his hospital in India, he said they had no backup generator. I said, wow, well, what do you do when the lights go out? And he said, flashlights. I said, okay, well, what if you're delivering a baby? And he said, lots of flashlights. So I thought, well, maybe I could raise some money for this, not knowing anything about fundraising. So that turned into a project. Once again, the connection came from the 60s in Wisconsin and the ideas that we have that we can do in Wisconsin to help. And so we now have an x-ray machine, digital x-ray machine, we have a backup generator, ultrasound machine, chemistry analyzer, fixed the roof, had an ambulance. They really didn't have an ambulance, they had a little vehicle. And then this year, we brought 4 people from Delic to the Global Health Institute. Lori DePreet and David Patt of the Global Health of the Global Health Institute said that they would give us tuition. So we brought the administrator, we brought the head nurse, and we brought 2 doctors. And the reason was we're trying to improve the healthcare records. And I thought, we don't really know what's going on. Maybe they need an electronic medical record because they have no records that they keep. The patients keep their records with them in a book, and they take them home with them. And as you can imagine, they get lost. So they came here. I raised some money to bring them here, housed them at Lowell Hall right near the Union. And every day they walked to the nursing building, which is where it was, 30 minutes along the Lakeshore Path. And they had breakfast. They walked together on the path for 30 minutes, walked together, coming back, and had workshops throughout the day. And they became a team. They never really talked to each other. The administrator was in his office, sort of runs things. The nurse was in her spot, the 2 doctors. They came together as a team. And what they learned was how to analyze a project. Now get this is the important part. Global Health Institute, they're people from Haiti, people from Thailand, people from South Africa, and a couple of other countries. And they all discussed their projects. And what they decided was, instead of doing an electronic medical record, they would try to reduce the prevalence of tuberculosis in the Tibetan children's villages. Now, the TCVs, as they're called, are really what we would call orphanages. The children live 10 to 20 in a cabin. It looks like an overnight cabin at camp. And they're dotted all around India, and there are about 10 of them around Dharamsala in northern India. Tuberculosis is a major killer among Tibetans. The prevalence of tuberculosis is the highest in the world in the slums of Brazil, the gold mines of South Africa, and in Tibetans. And we don't know why. We don't know if it's a genetic issue or maybe there was no TB in Tibet, but there's lots of tuberculosis. I worked with Johns Hopkins. We worked on getting a WHO grant and studied TB among Delics, so they've got some expertise there. Here's the problem, and they didn't realize that until they came to the UW in Madison just a few weeks ago. In the Tibetan children's villages, they're going to reduce the problem with TB. And what came out of the meeting was, when one child gets sick, let's say a child has a cough with some bloody sputum, and the administrator of the Tibetan children's village, maybe 2 hours away, thinks the child may have TB, they don't send them to the hospital right away because they don't have enough money for the ambulance. So what they do is they wait a week or 2 or 3 weeks until they have a couple of children who are sick, and then they can rationalize calling an ambulance to bring them to Delic. So in other words, they don't take the children and isolate them in a separate room, and they don't send them to Delic to get care right away. This came out in the Global Health Institute meetings. I got on the telephone, called up one of the people who support the project, a wonderful woman named Ann Down, who lives in Sun Valley, who has a small foundation interested in helping children. I told her what the problem was, and she said, OMG, oh my God, I can do something. Let me know how to do this. I'll fund the ambulance. Where did this come from? This came from the Global Health Institute, the University of Wisconsin, meeting with other people at the University Way, an incredible interaction. Not only that, but we now have 4 students who want to go over and help. One is an M1 medical student who has an MPH from Yale in epidemiology and infectious disease. He was taking the course. He wants to help them. Another is a young woman who is an M3. She is from Afghanistan. She wants to go over and help them. We have an M4 who's going to want to go over and help them. And then they met coincidentally, the assistant dean of nursing, who said she wants to send over nursing students, NP students, to the nurses to help them, and there'll be cross-fertilization. The students from the UW will learn about how to work in reduced resource settings, and the people at Delic, Tibetan Delic Hospital, will learn how to do things in the University of Wisconsin way in terms of organization. This is the Wisconsin idea, taking information, education, and what we've learned, and spreading it to our state, to our country, and internationally. And I hope with the work that I've done and with the recognition that you've given me for the Renner Award, which I humbly, humbly accept, that I have indeed earned it. Thank you.